Allow me to introduce you to our moderator, Jennifer Paganelli, practice leader of Earnest and Earned Media here at Real Chemistry. And she'll be leading this session again on disinformation and the digital determinants of health. And JPEGs, as we like to call her here, I want to turn it over to you and your great panelists so that you can get us started. Welcome, everybody.
Thank you very much, Mary. It's been an incredible day so far of dialogue, and I want to thank everyone for taking the time to join this very important discussion this afternoon as part of our Health Equity Virtual Summit. As Mary said, I'm JPAGS. I lead our Earned Media team. We're also very earnest, and usually at JP Morgan, we're dealing with reporters who are covering advances and news coming out of the meeting, but there's no place I'd rather be today than helping to moderate this discussion about a very important topic, disinformation and the digital determinants of health, featuring two incredibly passionate thought leaders who not only talk the talk, but walk the walk in a really big way. So I'll make a couple introductions. We'll get to our top 10 list of questions. We'll keep the floor open for your comments and questions, and I'll do my best to get to them. So let's get to some intros. First, let's welcome Dr. Lisa Fitzpatrick. She's an infectious disease doctor and CDC-trained medical epidemiologist. Her career has spanned medicine, research, global health, community education, and patient advocacy. She is the founder and CEO of Grapevine Health, and a phenomenal content creator in her own right. In fact, she just recorded her 50th episode of the Grapevine Health podcast, which highlights stories from and insights and experiences from her community members. So we'll dig into that and why that's so important. But Lisa, thank you and welcome.
Thank you for having me. Great to be here.
Of course. We've also got Dr. Garth Graham. He's the director and global head of healthcare and public health at YouTube. He's a cardiologist by training and brings really deep experience, not just in the private sector, but also in academia, government, etc. He's been in his role at YouTube for about a year now, so he cannot say that he's the newbie anymore. And we're really excited to hear about the progress he and his team have made in short order. So thank you, Garth. Thank you, Lisa, for helping us grapple some of these complex issues at hand. And as they relate to disinformation in a digital world and the very real impact on underserved communities. I want to focus on shared responsibility, investment, and the action you feel is needed right now by individuals, by companies, and societies so we can address it together. And don't sugarcoat anything. This audience can take it, so I want you guys to be real with us. So let's jump right in. All right, question number one. You are both so incredibly accomplished in terms of your health expertise, and you've had professional journeys that have taken some interesting twists and turns along the way. But I want you to tell us what personal experience or light bulb moment led you to your current role today or inspires your work. Dr. Lisa, I'm gonna put you on the spot and ask you first, and then Garth will follow.
Well, JPAG, thank you so much. It's great to be here. And I'm glad you asked this question because a lot of people don't actually know this story. There is a moment that led me, even though it was many years ago, led me to this moment right now. And that is when I was at CDC, I was also pretty engaged in the community. And I sat on a panel answering the community's questions about health. And afterwards, a man walked up to me, maybe in his 50s or 60s, and he said, "How does someone like me access someone like you on a regular basis?" And this is a man who had a primary care provider. He was on medications for his health conditions, but something about the way I was communicating to him spoke to him. And I thought, there are probably millions of people like him who leave the hospital and leave their doctor's offices every day, and they have no idea what to do or what was said. And I wanted to use my talents to help people like him. And so while it took me a really long time to get here, that's always been sort of my North Star, thinking about that gentleman, all the people like him, even my own patients who have told me about not understanding what we're saying to them. So.
Thank you for sharing that. Thank you. Garth, what about you?
Yeah, so I'll try to make mine short. And following Lisa is always a challenge. But I'll try to cut it into. So one, I would say personally, I'm from Jamaica. I'm Jamaican, but then grew up in the U.S. And I would. There were a lot of people in my personal life that, as I kind of got more education and felt I was learning more, would have disagreement in terms of views, and they would have different views of health as I kind of learned the traditional health system. And what I realized, similar to what Lisa was saying, is, a lot of folks in our communities, there's a couple of things that happen. I think one, the information that we generate in our kind of education or kind of healthcare infrastructure many times don't make its way in the right way down to the people like where I'm from and people in our community. And then similarly, many times there are belief systems within our communities that are not respected by kind of the traditional way in which healthcare is delivered. And I, as a clinician, oftentimes would find myself arguing with my longtime friends and people I'm so close to, people I've known since I was like 3 years old. And we have just very different beliefs, but it doesn't mean that they are evil or wrong, but sometimes it's just different views on the side. So this concept of how information makes people make decisions is often important to me. And then as a clinician, you see so often people make decisions based on, again, information. And I think information is a determinant of health, much the same way there's social factors that are determinants of health and other things that play into kind of the healthcare ecosystem and how people make decisions. So I think kind of both, professional living in a world of, of highly educated people who have education, and then another kind of highly educated people who have a different kind of cultural, some may say street smarts, but other kinds of educational world, and realizing we need to bridge those two in terms of how we share information with communities.
Thank you for that. Thank you both for sharing your North Stars and what kind of inspires you every day to tackle, what can sometimes seem like a really overwhelming challenge. Lisa, I want you to help us ground us for a second. A lot of us know what misinformation is. We've heard about the social determinants of health. Garth just mentioned kind of the information determinants of health. School us on the digital determinants of health and what that really means, because I'll tell you that was a concept that was a little newer to me. I don't often hear the phrase, so educate us.
Well, we're often coining new phrases. So even though we're talking about that today, just wait next week and then you'll hear a new one. So
totally.
But when I hear this term, digital determinants, it makes me think about access to technology and the technological tools that are so readily available for so many people in society, but with uneven access. And so there are a couple examples of this. One is we'll take telemedicine, since that's on just about everybody's minds right now in healthcare. When the telemedicine rollout happened because of the pandemic, it took a lot of catching up to ensure people who didn't have broadband access or didn't have the skill set to use the technology they have, whether it was their phone or their iPad. So what we saw was that a lot of people in underserved communities, they were less likely to access services via telemedicine until we were able to improve their digital literacy, help them understand how to use technology. And there's also a lot of fear in some of these communities, particularly among seniors who don't like to use technology, but they realize once someone helped them that, wow, this is something I can do. And there are still many people who have been left behind because they don't have access to technology and can't have a telemedicine visit. So we still have work to do in that area. The other big area that I think we need to talk a lot more about across the health sector, but particularly among payers, is access to remote patient monitoring tools. So these are things like pulse oximeters to check your oxygen, blood pressure cuffs, glucometers so that people with diabetes or who are concerned, they have pre-diabetes, they need to monitor their blood sugars. The access to these tools is also uneven. And so I think these are the things we need to be talking about when it comes to digital determinants of health, because the people who have access to these tools are the same people who've had access all along. And we will exacerbate inequities if we don't figure out a way to enable access to these tools and teach people how to use them who traditionally don't have access.
That's great. Thank you so much, Lisa, for grounding us there. Garth, I want to turn it to you for just a second. You have been in your role at YouTube for about a year now, and I think a lot about YouTube's scale, the reach. You're reaching 2 billion people a month, I think was the latest stat. It's insane, and the responsibility that really comes with that. So how has the company taken concrete actions to address some of the disinformation that's been proliferating well before COVID, but certainly COVID has shined a light on it, right? I think about vaccine hesitancy and the like, but I know you and your team have been heads down standing up some unique approaches to counter that. I'd love you to tell us a little bit about those.
Yeah, so, I view tackling misinformation as kind of multifaceted. First, decreasing and removing the misinformation, disinformation that people may see is one very important first strategy. So, reducing the risk that people may be exposed to bad information that may lead them to make harmful or bad decisions. And so we've been very proactive about removing and kind of evolving and continuing to be very aggressive in that context. First started with COVID, and then along the general vaccines route, being expanding a lot of that to kind of tackle vaccines overall during my time so far, to be able to tackle misinformation proactively. And one other important part of this is, then this goes back to kind of something Lisa was saying, is along those lines, people have questions. People are seeking information, and it is not that they're nefarious to seeking information. Many times people just want to make the best decision for their own family, and they may end up getting the wrong information, making bad decisions. And no information is also not helpful as well. And so being able to create information, to work with people who are creating information in culturally relevant, understanding the concept of health literacy and how you reach people, using video as a very concrete way to break down information. And quite frankly, worked with Lisa and others. And, some of the stuff that Lisa and her team have done, I think is on the cutting edge of how you really communicate with community. And so we've been trying to advance a lot of that work and advance it globally, not just in terms of how you work in DC and the Bronx, but also how you figure out how you work in India, how you work in Japan, how you work in UK, and working with a lot of the various entities there. So I think what we're trying to do is evolve how health information is communicated, understanding the importance of culture, understanding the importance of context. I use a really good example that, honestly, there's two examples I use often, is I talk about the work that Lisa did and does, and the man in the street, and how she takes the voice of the man in the street and amplifies it to be as important as anybody else's voice in this conversation. Funny story, some work we did with Dr. Fauci, where we paired Dr. Fauci with the rapper Fat Joe. And, it was really to try to get to deliver, at least when we're in the earlier phases of the pandemic, deliver information about not necessarily vaccine safety, because it wasn't, vaccines weren't already then, but at that point to understand how people could deal with their fears about COVID, but also understand safety measures. And in the middle of it, Fat Joe asked Dr. Fauci who's his favorite rapper. And I was like, oh my gosh, he's gonna lose the whole audience now. And he was like, Tupac. And he explained why Tupac was his favorite rapper. And what Dr. Fauci did there is he broke down the information or the cultural barrier to have people get an understanding of how he understands the culture, and so that his information can be delivered in a better way. And it's a small example. And again, like I said, I think Lisa does a more scaled, better example. Others who work in similar work that she does. But the whole idea of how you reach people in a culturally sensitive way is important. Gone are the days, JPAG, where people are looking for a flyer or a billboard as the other source of information. Gone are the days when me as a clinician, my word is all that matters. And if I go, well, jump 2 feet and then skip, people are going to do that. No, they're going to take information from different places, from people that they trust, and then make the decision. And there's nothing wrong with that. People should be empowered. And so this idea of how you shape information in a culturally appropriate manner, and the work we've been trying to advance, working with a lot of similar groups who do that, is particularly important for us.
Can I add something to a comment Garth just made about the video with Dr. Fauci? What's so important about that is the ability to express humanism, because it builds trust with people. Because so often physicians and other healthcare providers, scientists are put on some sort of pedestal, and we're seen as untouchable. But when we can be real and authentic and show people that we're human too, and that we don't have all the answers. Like, I'm someone who will readily say, I don't know, and share concerns. Like, right now is a great example. There are so many ways I've been humbled by the pandemic. So I think that is really an important element in trying to reach people with health information. Being honest, being relatable and authentic, and showing that you do understand, or that you share some of the same concerns and some of the same interests, that makes us much more effective at being able to get people's attention, and it builds trust.
And that's important. And that concept of building trust is important. And all of these things around trusting information, trusting science, that's what really makes people make decisions. So again, people to remove and tackle and remove and get rid of misinformation, that's very important. But what Lisa and folks who do her kind of work that we've been working with, pioneering, I honestly think is the future of medical communication. It's this idea of how do you digitally and in other ways advance the voice of the community so they trust you, and then decide and make decisions there. So not to persevere on that point, but that concept of trust is particularly important when you want people to, follow what you're going to say next.
Well said. And Lisa, did you hear what Garth said? You're going global, girl, and I love it. If anyone hasn't checked out the Dr. Lisa on the Street videos, after this session, not now, go check them out. They're really awesome, and they're real.
What's interesting about the comment, though, is that many of us, myself included, in the health sector, have a bit of an elitist attitude toward communicating with people in the ways they want to receive information. And so, namely, YouTube, social media, some of the gimmicks on TikTok. I'm getting there, but I'm not all the way there. I mean, I'm in my 5th decade, and so we trained in a very different way. Doing research in the standard way, and there's a process and sort of a culture that we are so, it's so ingrained in us to think, wow, we really need to change the way we try to meet people and communicate with them. And it may feel a little silly. I'm still trying to get comfortable making these Instagram reels, but guess what? This is where people are getting their health information, and they're using their phones to get health information.
And they're acting on it. They're making life or death decisions based on what they see. So it's not just TikTok.
So JPEG, I want to riff off what Lisa just said. And that is this idea, like similarly, I was trained and, in a fashion where we value, publications in journals. We value textbooks of information. And, we reward in academics and other forms of health careers, reward people who advance information in that aspect. And then we frown on the way regular people get information. And I think that's where I say that Lisa is on the cutting edge of I think it's going to change. I think all that's going to change. We have to start rewarding for how many people are listening and are you engaging, not just how many people hear what you're saying, how many people are you engaging. And so I often say publications and p-values and impact factor is nice. What's more important is who's listening. And that's really the crux of kind of how we evolve. And part of this whole discussion is like what's needed to happen next. And what I think is we need deans of education like Lisa that understand, educate the next generation, the current generation of healthcare providers around the importance of community-based communication, the importance of health information. And again, it's not to say that is a singular factor. We really have to have a concerted effort at scale around misinformation. And a lot of stuff that you see in the Surgeon General's report about a whole society approach, et cetera. All of those things I think are important. But along those lines, we have to evolve being in people's lives with information and rewarding those as a currency almost more than we do scientific publications that sit on shelves and nobody ever reads them.
Amen.
Very well said. I mean, even as, teams like ours, we're communicators at heart, right? When we go to meetings like ASCO, the big cancer medical meeting, or AHA, or ACC, it used to be the doctors that were on the podium doing the plenary. They were the thought leaders, and they're still important. They're still driving important research. But in terms of influence and relevance, it is people who, like experts like you all, who can meet people where they are already living their lives. People are not living their lives in Medium, fun fact. They're living their lives on YouTube, right? And that's gonna, folks who can, and so that's my question then. Lisa, I'll turn it to you. Should health literacy or community-based kind of communication, modern communication approaches be taught in medical school or just school earlier?
Oh, absolutely. But I also think we can't really wait another generation or 5 or 10 years for this to take hold. This has to start happening now because people are dying because they get misinformation or they don't understand how to take care of themselves, little actions they can take. And so we should be teaching this upstream so that students across the allied health professions understand this. But those of us who are working in the health ecosystem right now, we've got to get on board. We have to start partnering. We have to find ways to collaborate to get that information that's so cherished in these manuscripts and these peer-reviewed journals. We have to get it translated in a way that people can believe in it, trust it, and use the information. And so that's where I think we're really falling down because this divide that Garth and I are talking about, sort of, I use the word elitism again. We have to move past that and recognize that the science is still important, but we have to partner researchers, scientists, healthcare providers. The language we're speaking, it has to be deconstructed and demystified so that people could actually use it and want to engage with it. Because some of the feedback I get is, I'm tired of your charts and graphs. I don't want to see any more graphs. And so you ask people where they're getting their health information. It's not from researchers who are showing graphs. It's from their grandmothers and their aunts and uncles and their, the sexy video on Instagram. So we have to get with the program.
It's so interesting, Lisa, and Garth, go ahead, build on this. I know you got something to add.
You reminded me of something I saw the other day. So I have some very ill-behaved kids that are my own, that are 6, 4, and 2. And my 4-year-old was at the doctor and was just freaking out. And she got down and she started to talk to her and play with her first and engage her first. And then after that, I couldn't get that little girl to stop talking. The whole thing just changed. And it wasn't until that experience. Again, just kind of underscore this concept of engagement. But Lisa just said something about how we need to teach people that concept now. This is just another version of those ideas. These are versions of patient engagement, patient-centeredness, putting the patient at the center of the equation, as opposed to us as the healthcare delivery practitioner at the center and wanting to say things and deliver things the way they want to. And so I think that, and a part of this conference, and I was, watching some of the other things people have been talking about, is what are the bold ideas that we need to do next? And I would take I would put Lisa's work as a prime example of that, and others who do that kind of work. That we need community-based education at scale now, and we need to teach that. And value that in clinical medicine and public health, because the downside of that, as Lisa said, can hurt people in a variety of different ways.
Amen.
And I think
Amen.
doing it at scale, the beauty of the smartphone is how we do it at scale.
Yeah.
But that's why it's so important to figure out where people are paying attention. What are they, when they wake up in the morning, where are they scrolling on their phone, and why aren't we in those spaces? See, the healthcare sector is often behind because we are so stuck with our own processes and our own culture. And so the sooner we can pivot to recognize that, a bit of this is marketing. Like, how does Nike sell shoes? How does Coke, get so many people to drink? Because those commercials, they touch you. Why can't we be more like that in our communication of health information?
Well, we have to be, because we're not selling sneakers. We're not selling soda. This is life or death health information. So if ever there was a time to step up, it's now. Right on the line right now and tuning in, you've got a lot of communicators from the biopharma industry. Okay, companies that are developing new treatments and COVID tests and vaccines that are saving lives. How can industry get involved? How can they make investments here? Or how should they think differently about the ways they communicate? Because we spend a lot of time counseling clients to kind of get with it and show up in more modern places and differently.
Wait,
I don't want to hear from me. I want to hear from you.
I'm going to go first because I was a setup to Lisa's answer. They need to work with more Grapevine Healths and other related organizations. And it's not meant to oversell this one as I'm trying to articulate. But the truth is we have to understand people who understand people. And working with people who understand people. And we have to, again, think about how we do that at scale. And so, again, a big part of our work this past year has been how do we invest in efforts like these and allow them to not maintain but develop in their own way. And it's just amazing it doesn't even matter what platform they're on, just amazing to watch it. So I wanted to set that up for Lisa because I do think that, for organizations, especially come from a more formalized part of healthcare and are trying to think through how to reach people, I think there are people who are doing it. And, working with them is particularly important. But then that just sets up Lisa for her answer.
Garth and I have probably been on panels together, so he can anticipate what I'm going to say. So at the top of this conversation, you told us not to sugarcoat, which I tend not to do anyway. But I'm going to be just like really plain here. When it comes to the pharmaceutical industry in particular and biotech, there is a severe trust deficit that needs to be bridged. So the way information is communicated from these companies right now is far too sterile. It's not relatable. It's far too scientific. And it further exacerbates the distrust the community has, particularly in pharma. And so I'll just tell you a quick story here. A few years ago, I moved into an underserved neighborhood so that I could sort of be in the know. And I got to know one of my neighbors who had multiple health conditions. And every time I saw him, our conversation would veer toward his distrust of his doctors. Why? Because every time he went to the clinic, he would get a new medication. And he said, those doctors and pharmaceutical companies, it's all just a game. They're just trying to make money. There's nothing wrong with me, but every time I leave there, they give me new medication. So amongst ourselves, we probably understand that he needs medications, but if it's not communicated to him, and if you look at the optics of how the community views what's happening in the health system, it's a business. So they don't see people reaching out to trying to go the extra mile to help them understand what's happening. What they see is, I'm walking in for this symptom and I'm walking out with all of these prescriptions. Are you trying to poison me? Like, what are you doing? You're just trying to make money. And that's real talk. It's uncomfortable for us to listen to that, but we have to own that and figure out how we are better stewards of information and communicating that information in a way that people begin to trust us. So I think the first step for biopharma or biotech also is to first listen to the community and start to figure out how you bridge that trust gap. Because beyond that, we won't get people enrolled in clinical trials. We won't get people taking medications, on the schedule that's prescribed. So adherence will continue to be an issue. We have to understand the root of these issues, but we do that by first listening and being humble enough to accept the information. So I'll stop there.
I think that's great. I mean, it's so true. And it's hard, listen, we're speaking truth right now. You can't communicate effectively if you're not listening first. You talk about listening ears. I've heard you talk a lot about that, and really kind of immersing yourself in someone else's perspective, and this idea of being humble enough to know what you don't know, but really take action to understand, so you can address those, the skepticism, the distrust, and everything else. It sounds like there's more we can be doing in a very practical sense to address that, companies, individuals, et cetera. And
I'd like to pose just a rhetorical question, though, to the pharmaceutical companies that are listening. There's a lot of discussion about how to diversify clinical trials. I mean, I've been involved in this kind of research. I've, done some focus groups on this, but this question is still looming large, despite this question being posed for 2 decades or more. And so if clinical trials are complex, not well understood among the community, and difficult to access, what are we doing to fix those problems? Those are the fundamental reasons we don't see diversity in clinical trials. So aside from the trust issue, is it accessible to people? Do they know about it? Do their providers know about it? Those are some basic things we can do so that we can stop having this conversation and ask this question. 10 years from now, we'll still be asking, how do we diversify clinical trials? Because we haven't done the work yet.
We haven't, and that kind of gets to a question about shared responsibility. None of these issues we're talking about can be solved by any one stakeholder group, right? It really takes all of us, I mean, I think about the biopharma industry. Well, they should be sharing the right information at the right time for folks so they can get involved in trials, because we know that that's critically important. But, we can't just overly rely on digital tools to do that. We've got to meld the digital tools with the human, right? Mm-hmm. Working with translators, and the right voices that are trusted in the community to address some of these gaps and be real about those types of partnerships. I think you're hitting on something that's critical.
Well, and JPAC, one of the things that was unique about mobilization around COVID is so many folks started to see themselves as part of the solution like never before. So I think there are opportunities. The challenge is, as many times, whenever an urgent situation no longer becomes urgent, people fall back to what they were doing before. But I do think now is the time to think about what we do next. Listen, the public has never been more interested in science than they are now. And the question is, how do we make it understandable and relatable? And I honestly think we're at a cusp in terms of health education and bi-directional, how we educate ourselves as healthcare providers, but also how we educate the community and how we bring those two together. And I think the question, and in panel discussions like this and others, is how do we genuinely move forward? Because as Lisa said, a lot of these challenges for those of us who work in this field have been repetitive. We've gone to the same meetings, had the same discussions, had the seeing the same people and like, oh, weren't you here 10 years ago? We were talking about, these set of problems. And I think the question is, what are at least the incremental solutions so that we somehow get out of the repetition or repetitive nature of how we've been addressing the challenges so far.
Well, if that's not a good metric, the fact that you should not be saying that, a year from now, 2 years from now, that you're seeing the same people, it's like Groundhog Day. We can't accept that, right? Listen, I've been told that we've got a few minutes left. It went so fast. So maybe what I'll end on, and this was a tremendous discussion, and there's so many other questions I have, but what are, in your opinions, the 1 or 2 actions, they can be big, they can be small, that you'd like to see us take from our audience right now to address some of these issues we've talked about? In fact, just give me one thing you want to see, one action. Garth, I'll give it to you, and then Lisa, you can close us out.
Put ourselves in the shoes of the people that are either receiving the information or receiving the service, or who we're trying to reach, and understand their lives first, as opposed to trying to understand our own structures of delivering information first.
And I would say just challenge your assumptions about what you know, because a lot of times we approach these problems because we've been working in the field for a long time. We think we understand what it takes to solve the problem, and maybe we don't. So I agree very much with what Garth is saying. We have to be willing to humble ourselves, listen, and incorporate the feedback we're getting from the public.
That's great. Yeah, if there's one word I'm taking away from this, it's listen, and really be open-minded and acting, and be humble. So thank you, Lisa and Garth. I can't thank both of you enough on behalf of our audience for your candor today, for the important work you're doing in your organizations. Lisa, it sounds like you're going to be a star. So like, if you need a publicist, I can help you. It's fine.
Already.
It was like Garth said it first.
We'll check back in this time next year to talk about that. But in all seriousness, thank you. Thank you for helping us understand these issues. They're not easy. We need to get real about, how we approach them and how we actually do something together that's going to move the needle, not be more of the same. Mary, I see you're here. Why don't you close us out?
Yes, I am here. They had to remind me to get back on because I've been taking just furious notes. This has been super amazing. I love this session. It is so real when you think about the fact that we have got to get out of our own selves if we can. And when I say ourselves, I don't mean just us physically, but out of our own walls, out of our own mindsets, meet people where they are. I loved the comments about how it's information that really is what is making the difference. I love the comment about the smartphone and how there's so much more that we can do there. And are we thinking about what do people look at when they first wake up in the morning? What are they going to? They're not reading scientific journals and doing all these things. They're
maybe Garth is.
Yeah,
he's not.
Right. They're not even reading, their prescription bottles or whatever stuff we think that they are doing. It's not happening. So there's so much more when we understand about the potential value of the digital determinants, about the fact that disinformation is literally killing people. And so even though, there is some humor in how we talk about it, understanding where people really go for their information and, talking to folks in ways that they can relate to each other. Who knew that Dr. Fauci liked Tupac? I like
I didn't know.
Right.
But I mean, making people human like that just makes...
It's not rocket science, it's connections, as my 5-year-old would say. Connection, it's a human relationship connection, and if we can ground ourselves there, I mean, we're already 2 steps ahead, but anyway.
Exactly. So thank you, JPAC. Thank you, Lisa. Thank you, Garth. This has been an amazing session.